everyone. Welcome. I was watching the intro. I'm like, wow, we've only been doing this for a few months, but we've aged.
Well, it's because
Yeah, all the white.
we let the stuff grow.
It's like,
Right.
wow, we look different from like 2 weeks ago. But anyways, welcome everyone to Beyond the Smile. Thanks for joining me, Dr. Mark, again. So
Always a pleasure.
So today, I was getting prepared for this. I'm like, I've talked to Dr. Mark about so many things. What am I going to talk to him about today? And I'm like, I'm going to have some fun today. I'm going to get your impression. I can't wait to see your face when I ask you some of these. Okay. So what I've looked is I kind of looked online and looked at TikTok and Instagram and Facebook and found DIY dental hacks. Let's say that right. Dental hacks. So do it yourself. Dental hacks that people are using at home, and you're gonna tell me, are these like you're out of your mind? Are you like crazy? Or you're like, no, those things could work for you?
Yeah, this is not like the drink bleach.
No, we're not gonna drink bleach. Okay. No one drink bleach. Okay, please don't. All right. So the first one I found was on TikTok, and it's a for teeth whitening, and it says this will happen overnight. So of course, right away, if you want instant gratification. Yeah. So it's mixing baking soda and lemon juice and then brushing your teeth with it or put on your teeth, and it's going to whiten your teeth. Is that truth or is that trash?
I would say there's probably truth to it, but I would say there's danger to it.
Okay.
Because essentially what you're doing is you're bathing your teeth in acid,
right?
And then you're scrubbing it with sand. So
I don't know. It sounds good. What are you talking about?
I mean, it's table that we feel.
Yeah,
that's
right.
You feel it. It's beautiful, and it's easy to keep clean and maintained because it's got a nice, smooth
finish to it.
Right. Which is the way that an enamel works. But if you suddenly turn that into something that's like the craters on the moon, you imagine now, okay, whiter, but how much stuff is going to get stuck in there? What's your like developing cavities? And I bet you dollars, you're going to have a too, especially if you continue to do that.
So because when I was like baking soda could potentially be used to clean your teeth, like that's kind of like, you know what I mean? But you're saying the opposite is that it'll clean your teeth, but it might damage them at the same time. Is that kind of what we're saying?
Yeah. Well, I mean, the consummate example we give is, we're in the country, of course, right? We tell people, it's like, okay, well, you have a glass of red wine. The last thing you do is you brush your teeth because you have acid, you got sugar, and now you just put it in your teeth. So, I mean, it's far better to do things like dilution and etc. So you have to be, I think, a little bit critical and cognizant of what's going on and what that result is. Yeah, you might get the thing that you're looking for, but you might also get two things that you're looking for.
Interesting.
And I think even if you go back historically and you look at the first whitening products, they were essentially like, let's throw some acid on your teeth.
Right.
And then I think the active ingredient was actually kind of like the active ingredient in white paint.
For real?
Yeah, I'm not even joking. Thankfully, we've come a long way.
Yeah, I was going to say.
Then,
So when I drink a glass of wine, what I do next is drink another glass of wine.
Yeah, well, that's okay too. Yeah.
Okay.
Yeah. Try to limit the exposure. I mean, if you're drunk,
that's a different podcast. Okay, cool. So the next one that I found was, and this was, I found this was a big like craze like a few years ago, and everything was charcoal. Yeah. Like charcoal was like, I know you could buy charcoal smoothie, ice cream, and all. So it's activated charcoal toothpaste, and it's like I found it all over Instagram as a natural way to whiten your teeth. So does that work, or is it really a trend? And I don't even know the background of like charcoal and what it does, and I'm like, it sounds like it's bad for your teeth because it's black. But anyways, maybe that's a different discussion.
Yeah. To be honest, I think maybe there's a small element in both, and I'll be perfectly frank. Just looking at videos, I would never even put something black all over my teeth. So, full disclosure, I never really done to it. In terms of, but the sheer fact that you don't have major companies, corporations behind that, would tend to lead me to believe maybe it's more fact than it is actual truth.
Because I think there was like a health benefit to charcoal, and I think that you find them in like health smoothies, all that sort of stuff. And I don't know the background around it, and I just think, to me, I was the same thing. I'm like, well, if you're putting that color on your teeth, like, is it going to do
Yeah, I don't know how it works from a whitening perspective.
Right.
I mean, your teeth are probably gonna look white by the sheer there's something black on them and you wipe
Yeah,
it
yeah,
off.
right,
But
right, right.
uh, yeah, I personally have seen zero non
Interesting.
studies.
Okay.
Right?
This is probably one of my favorite ones. I'm like, why would you do this? But anyways, so there's people on social media that are using random household items to floss their teeth. So sewing thread,
Yeah, okay.
a fishing line. So to me, it sounds super painful. I'm like, I can barely get like sometimes the regular floss between my teeth. So imagine a fishing line, but there has to be like in maybe thread, but there has to be like you have to cause damage by doing that, don't you? And I know sometimes you do stuff on social media for like you want the views, but don't you think it would cause damage by doing that?
It depends on how skilled you are, I
Maybe.
guess. Right? So it depends on your dexterity. So for example, people that have really tight contacts, you're never going to get fishing line in
Right,
between,
no.
nor should you try.
Right.
I have patients that have large spaces in
Right.
between their teeth, and I think it would be fun to floss with fitting yarn.
Yeah.
Right? So the idea is that you get the thing in between the teeth
That
as
you
you
can.
possibly
Right.
safely can.
Yeah.
Right?
Yeah. Yeah.
And then the technique becomes more important. If you don't know what you're doing, you can very definitely a lot
For
of pressure
sure.
and tissue trauma. Apart from the hygiene side of things,
Yeah.
right, in
Yeah.
terms of how
Yeah.
clean
Yeah.
is it when
Yeah.
you're putting it between your teeth, it's far better if you've got those challenges where you can fit different things in between your teeth. And again, professionally, is the actual point of contact. That's floss. Okay, so you get bacteria from in between the teeth, but anything that's in below and around, I'm a water pick. So
Interesting.
yeah.
Love it. Okay. I thought you'd be worse. I thought you'd be like you're an idiot by doing that, but you didn't say that. So I said it. So
You
not
could be. That's what I said. It depends on a lot of factors.
I get it. So another trend floating around is using coconut oil to rinse your teeth. Oil pulling, and it's supposed to clean your teeth, improve your overall health, and oral health. Is there truth to it, or is it just like wishful thinking? It's not going to.
No, there is some benefit to it,
Okay.
but the problem is, I think, in order to be effective, my understanding in terms of what I've read is you're looking at like a 10 to 12-minute swish.
Oh wow.
So again, per our earlier discussions, the average length that somebody will brush their teeth is probably somewhere around 5 seconds.
Right.
So you try to get anything for 12 minutes.
Not going to work.
Very, very few people.
But you're not. To me, that one probably is not damaging anything. By
No,
doing
it's
that,
just
right. It just might not work, or might not doing enough of it. Interesting.
exactly.
So here's like, let's put this in a category of weirdness. So rubbing banana peels on your teeth to whiten them. It's supposed to be natural, chemical-free solution. Have you ever tried that? First of all, rub like banana peels?
No,
Why
but
not?
I
Doesn't everyone do that?
Well, I have a bit of a weird habit. I have to confess.
Do you want to stay live on this?
Yes, it's fine. My kids bug me about this time, but if the banana doesn't want to, open naturally, I will
bite it
almost monkey style, bite the edges and snap it. So to say that I've never had banana peel on my teeth, probably inaccurate.
Yeah, fair enough.
However, I have not heard that at all.
I don't know how that would even work.
I would have to get into the chemistry of the whole thing,
right.
But generally, again, to whiten your teeth, you're looking for some sort of, volatility.
Right,
right. I just can't see doing it.
Plus, it's funny because I've done what you said before, and
actually,
the taste. I didn't know what you're going. I didn't know what you're going to say. I'm like, I have a confession. I'm like, what was going to say? But the taste is gross. Like it leaves a really weird taste in your mouth.
Yeah, and the film. And,
yeah.
Plus, so I mean, you don't really want to.
No,
there's a whole technique.
Yeah, that's right. Another hack that I found was that people that are using hydrogen peroxide as mouthwash.
Yeah, I'm okay with that actually. But you need to be careful in terms of how you. Okay, so there's different concentrations of peroxide. Most of them you get 3%. And then you don't want to. I would not necessarily that you're straight up.
Right.
So what I would advocate is, you take
it.
about this much water, you put a capful in, maybe a little bit less water. Peroxide itself is very frothy, and peroxide is essentially the breakdown end product of the dissolution of ozone. Ozone is wonderful insofar as, if you ever picked up a bottle of water from the gas station, and it says it's ozone. Well, there's no active ozone in there, but there is no impurities in there whatsoever. Absolutely crystal clear, because that ozone kills everything, right? And it breaks down to peroxide essentially. Now, the other thing that happens with peroxide is, we used to have hair back in the days.
Yeah.
That would be peroxide.
Wait a minute, you had frosted tips.
I did.
Wow.
I even
We've learned a lot in this screen. Wow.
But nevertheless, you have to get to some sort of peroxide basis to actually effectively change color or strip color. So even teeth whitening products will be converted to peroxide. So that can actually chemically start to irritate your tissues if they're too long.
Got it.
So you want to give a good swish for 30 seconds or so, which is
normal.
12 minutes, and then rinse with water. It's just to dilute it. But it will go along in terms of killing things that are looking at opportunistic action.
The real question out of that is: do you have pictures when you had your hair? Like, can you bring them in next time? Okay, we're gonna show them next time. We totally are. This is maybe not as much as like say a dental question, but kind of, because it involves toothpaste. Is that people are using toothpaste to put on, like, to heal pimples or a mosquito bite or anything? Does that actually work, or is that just a placebo that you just think it's going to work? It's going to stop the itch and any of that stuff.
Yeah, I mean, sometimes in teenagers, I even back then I used to put toothpaste particularly on pimples, and it was more to dehydrate it, right? To combat the oils. I am not a dermatologist.
No, for sure.
Anecdotally, people swore by it.
Yeah.
I personally never tried it. Toothpaste has always gone in.
But the science behind it could work then, potentially.
It could work, and I certainly don't see that there are harm.
Right. Yeah, you're not doing too crazy.
Maybe don't pick the super colorful ones.
Yeah, that's right. The charcoal one.
Yeah, exactly.
Apple cider vinegar has been around for a while, and it's sort of like people use it for everything from like weight loss to and now people are saying they're using it to rinse their mouth. It's supposed to help your smile. It's supposed to help with teeth whitening. What is there?
It's acid again. Anytime you're in vinegar, you're talking about acid. And acids will eat protein and deposits and things. And it's not car wash.
Right.
So there, when you look at the color of your teeth, some of the color is your color family, like it's embedded in the teeth. And unless you get past the superficial layer, which we all have on our teeth, and get to the color that's trapped in between the crystal structure, you're not going to affect that change, right? So a lot of the things that these seem to be talking about are topical, right? So things that are actually trapped on top of the teeth. And even then, some of those are so heavily stuck there, especially if they've, ruined the smooth finish of the teeth, that you need to have a professional take it off with equipment.
It sounds like a lot of these hacks are creating patients for you, is what we're saying. I get it. I got it. Okay. So this isn't necessarily a hack, but it's something that I was thinking about when you're a kid, and all the time where your grandma or grandpa or your mom or dad would pull your teeth for you when it's loose. They'll put a string and pull your teeth or whatever. Sure. Maybe not the whole door thing you see. Like maybe some people have used a tie string. But is that safe though? Like, should you be doing that even if it's really wiggly? Like, or should you go in and see someone to actually do that? Could you cause damage, or would you cause damage by doing that?
I guess the short answer is you can cause damage. I've seen all YouTube videos. It's more the adults that do strange things. Like I've seen videos of guys standing on like a loading dock with a concrete brick and it's tied to a tooth and they throw it over.
Right.
I mean, the tooth might be hurting you, etc. But there are cases where teeth are like partially fused to your bone. Right. That's not going to come out unless you cut bone or chunk of bone. So yeah, I mean, would I advocate it? No. I definitely wouldn't.
So if it's really, really loose and hanging there, when I was a kid, like literally you just like pull it out?
Yeah, what I tell kids to do, quite frankly, is to try to twist it. So the inside is the outside, the inside. The fibers, because at the end, it's really only a little bit holding onto it. That's really what you want to break. So you're not wiggling it out of the bone.
Right.
You're getting the tissue to loosen. So it's more like a screwing action will pop it out.
So if that happens, though, if it's loose and you do pull your own teeth, what should you do? Like, is there a way should you get some of that hydrogen peroxide mixed in water and rinse it? Like, how do you make sure that it's safe before you can get to the dentist?
If you're a kiddo, I don't think there's too much concern.
Okay.
I would just make sure that you have some sort of, you can even do, clean tissue or paper towel, just fold it up and water and create pressure. Right? Like any other wound or cut you have anywhere, just pressure will stop the bleeding. But
right.
I don't get too crazy about disinfection.
If you're an adult, too bad. Like if you're an adult, you're playing hockey, you get a puck to the mouth and 2 of your teeth fall out. What should you do? Like, is there a way to should you be doing something to help the structure before you can get into a dentist? If it's 10 o'clock at night and you're playing rec hockey, and you can't go see the dentist.
So first of all, if you can find the tooth, oddly enough, stick it in your cheek. You want to keep it.
Well, interesting.
Okay. Even better if you're got some bacteria, etc. Put it back. Like literally put it back in. The tooth for sure will die.
Right.
But it gives you your best chance of actually saving the tooth, and then things that we do to obviously dead nerve, etc. But first things first, can you find it? Keep it moist, put it back in. Right?
Okay.
And then time is of the essence, right? Because what will end up happening in the place where that tooth has been, this is the case, an entire tooth is lost root and all. That socket site will start to fill up with blood, and that will turn into new skin, and then now you've got stuff in there that you can't push the tooth through. So now you've got a different problem. So you've got a relatively short window to push it back in.
Interesting. You must have seen, we want to do a whole video about this because Dr. Mark actually works with the Kelowna Rockets for how many years now? 14 years. You've seen, I'm sure, lots of kids coming in with teeth missing, knocked out, punch, fight, puck, whatever, broken, chipped, everything. So I'm sure some interesting stories over the years on kids coming with their teeth in their hands or not.
Well, they usually don't come with the teeth.
No, they're gone.
Because I home games. So if we're here, then I can help them. The ones that inevitably they're coming back from
East trip. They've gone to Prince George, Moose Jaw, wherever they've gone.
I get a text at 10 o'clock at night and say, hey, can you see so in the office on Sunday? Here's what we're doing.
Do you have any famous teeth? Do you have Leon Draisaitl teeth in your office or anything? Do you have any famous teeth sitting in your office? Because that'd be kind of cool.
That I had to take out?
No, that's sitting there. You should just have a little, you should have them framed, the teeth of the people. That'd be actually kind of funny.
No, but I do have photos of famous people that I fixed.
Yeah, that's cool. Yeah. Cool. You have pictures of me on your wall. Nice.
Nice to hear
that. So the last question I have is around, so we've talked about it, and again, some of these were fun. So actually it's interesting because some of them you're like, no, it's actually not bad. Like hydrogen peroxide and everything. I thought you were going to say, no, you don't put that stuff in your mouth. But there are some home hacks that are okay. It sounds like, and everything, there's pros and cons and do them right. But is there anything from that if someone wanted to try some safe and effective at home sort of to help them with their smile or whitening or anything, is there anything that you recommend they do, or do you really try to stick within?
Just talk to a professional first.
Do you kind of want them to stick within, hey, use that's been proven? And,
no, I joke.
No, for sure.
I'm not a dictator, so and I'm not going to follow you around and
no.
control what you do. But if you want to know what's going on with it, and I'm very happy to share.
Right,
and then as long as you're sensible about your approach, and you don't feel harm is, it's
for sure, yeah.
Have at her.
Yeah. So what you're really recommending is before you do something, don't go to TikTok and take their word.
No.
Ask your dentist.
Yeah, I don't go to my baker and ask him.
No.
It doesn't make sense. Right?
You don't?
No.
So one thing that's kind of interesting, I did a live stream a couple weeks ago on, it's called the Phil store. I don't know if you know that. So they have a couple locations, one in the mall now, if you're Chris, where you can kind of go, you can fill your detergents. And one of the things she was saying they have is they have refilled toothpaste. And I was joking, I'm like, how do you put the toothpaste in the little back into the little toothpaste thing. But she's like, they have capsules, little tablets. You pop in your mouth and like foams up, and then you brush your teeth with. And you ever? And I'm like, what? So I'm like, that's kind of cool. She goes, it's actual toothpaste, but you just pop it in your mouth like a tablet.
Yeah. I don't know. That's interesting.
Yeah, it is interesting, actually. I thought it was kind of interesting.
I've never tried it. I mean, the one thing I'll say about toothpaste is there's a lot of different choices, obviously.
Right.
It kind of drives me a little bit crazy because, if you got Colgate Total, why do you need Colgate?
Yeah. There's literally like
why would you not choose like
the total one? Yeah.
But the reality is that these different preparations, different tolerances, so people react differently to them. So just if you're switching products, the only piece of advice kind of pay attention to how things look and feel because may or may.
Well, I'll say I'm a sample size of one, but I've had a couple hygienists working with you. My teeth are somewhat sensitive sometimes because of neglect.
You're sensitive.
But I am, yeah. But out of neglect, really, because that's a whole different story. But they said to use Sensodyne, and it's actually been. Good. I don't have any wood. Knock on wood. The best thing. It actually has really helped me for sure. And I'm like, again, I always wonder, like, is it placebo or is it actually something in Sensodyne that works? Either way, it works. I'm definitely less sensitive when I've been using Sensodyne.
Sensodyne happens to be a company that has a really good and robust research and development.
So there's something in that toothpaste that does help sensitive teeth and gums.
Correct.
Yeah.
Depending on what's creating the sensitivity, and again, earlier.
Right.
I mean, if you've got a cavity,
ain't gonna work.
He's gonna use this.
Just putting it in there or whatever. Awesome. Well, thanks. That was fun. I thought you were going to call like I said, I'm like, Dr. Mark's going to call everyone an idiot on this for doing this home stuff.
Yeah, so. Sometimes I would like to, but I also don't want to be canceled. So.
No, that's right. I will be, it sounds like, but that's fine.
That's okay.
That's fine. You have a different host next time. Our robot host. That'll be more sensitive.
As long as they don't have better hair.
Yeah, there you go. Well, thank you for tuning in. I would actually be curious if you're listening or you watch this, like put in the comments any hacks that you've either seen or tried or as well worked. Or worked. It would be kind of cool to see that. Actually, it'd be kind of interesting to see because I mean I feel that my opinion, and I'm not obviously the right person maybe to give this opinion, but I will, is just go see your dentist. But like I don't know, just like go ask before you don't take social media as like. I'm going to do something because I can take a banana and rub it on my teeth. It's going to get it white. Like you have to, and maybe it works, but it seems odd.
I mean, nobody's going to jump on media and, straight off financially.
No.
Or shouldn't.
Well, some people might. So.
Yeah.
But you shouldn't. Right. Yeah.
Right. So I just, fact check.
Yeah.
Right?
Love it.
Yeah.
Well, thank you for coming in. I think it was fun going through that. So, and again, put your ideas and comments and the hacks you've done that worked in your comments would be awesome to hear about. And thanks for joining us, and we'll see you next time. Thanks.